This is Dr. Crawford, orthopedic surgeon in Hawaii. We're going to be going over some injury treatment, prevention, and some overall guidelines on how to treat some injuries and pain. So please don't let this supersede you. If you think you've been really injured and you need emergency care, please call 911, go to the emergency room. I'm here to talk to you about hip injuries and hip pain. Hip is a specialty interest of mine. I did a separate fellowship in the hip because I was so interested. The backstory for me is that my brother played the NFL and he had a hip injury, and they had no idea in the early 90s how to treat that. And it was just in its infancy of being understood. So to give it just some backdrop, we've been scoping knees, which is a minimally invasive surgery in the knee, just through cameras. We've been doing that for 100 years. And in the shoulder, we've been doing it for probably 50, 60 years. And then in the hip, it was brought by Tom Bird really to America in the early 90s. And so it really didn't catch on. So we're really in its infancy. And so there's not too many hip specialists out there. I got really interested in it, and I see that a lot of people are suffering from it. So I thought I'd put a video together just to go through some of that. If you're hurting, what you can do about it. I also brought in a therapist today that I think is really well versed in the hip. Obviously, being such a new specialty and the fastest growing specialty in sports medicine is the hip, you see a lot of maybe misinformation, or just people aren't really trained in that subset. So to make sure patients are getting the right knowledge out there. Obviously, if you've really been hurt and you feel like something's really badly injured, you should go to the emergency room. But in large part, 95%, maybe 99% of my practice, they don't need emergency room care. They really need a hip specialist or somebody that understands the hip. So if you tweaked your hip and it's really not that bad, you may not need a hip specialist. But if you're having an injury and you're worried about it, a hip specialist is a good place to be. So the diagnosis that people are suffering from middle age down, if we break them up into two categories, from let's say mid-40s down to the adolescent. So we're not talking about pre-adolescent, your young kids, your toddlers. They can get different problems in the hip that we're not going to cover today. But from adolescence to your mid-40s, the number one diagnosis is called FAI. FAI is basically hip impingement. Hip impingement is when the two bones of the hip, the ball and the socket, bang into each other. And after banging into each other so much, they can tear your labrum. And the labrum is a really important, densely innervated with nerves structure in your hip that causes a lot of pain and dysfunction. You might have seen it on ESPN, you might have seen it somewhere else, but an injury to your labrum frequently results in prolonged disability for the athlete or the patient that's suffering from it. As you get into your middle age and older, we're not dealing with so much hip impingement and labral tears, we're dealing with more with the dirty A word, which is arthritis in your hip. Difficult to treat, difficult to stop, but there are some things movement-wise, rehab-wise, activity modification-wise that can help you. And so we're going to go over some of that with the rehab therapist today. So we're going to cover the 5 most common questions that I get asked by my patients coming to see me for a hip problem. Number 1, I'm hurting in my hip and where should I go? I think a hip specialist is a great resource for you, especially if it's ongoing. If it's a strain, muscle strain, your family care doctor, urgent care, things like that can be a good resource for you. But if it's ongoing and you're worried about it, I think a hip specialist, which sometimes is hard to find, can be a good resource for you. There's also some really good physical therapists out there that are really good at the hip as well. The second question I get asked are, what are some things that I can do now that my hip is hurting? Because a doctor, really good at diagnosing, treating the problem, but they don't necessarily put the hands on, get you feeling better right away. So what are some of the rehab aspects and things that make your hip move better and function better? I thought I would bring in a great resource with Bart Kellner from Physical Therapy to go over that with you. So we're going to go over that in a minute. The third question is what did I injure in my hip that's causing me the pain? And we covered that a little bit. The labrum is the main thing in the adolescent to middle age category. And after that, it's really the arthritis problem. Arthritis equals cartilage damage in your hip. That is what arthritis is. And over time, you're going to get some degeneration in the cartilage. In some people, genetics seems to be the most important factor for that. But if you're getting arthritis in your hips, it's sometimes not the worst thing in the world. A lot of arthritis will stay dormant, and you can learn to deal with it and stay active. If you're younger and you're having just persistent pain, the number one thing we're worried about is your labrum. The fourth question, how long does it take? How long should I give this before it gets better? When do I know when to seek help? You know, I think if it's a minor strain, a little tweak in your hip, and it's better in 1 week, maybe 2 weeks, and you're not using crutches, it's so bad, that's a good sign that hopefully you injured something, you tweaked it, a bruise, it's going to get better. Maybe the muscles need a little time to recover, and maybe some of the exercises we're going to show you today really help you get back on track. When you need specialty referral and maybe see a hip specialist is when things are not going well. You're on crutches, the pain persists, wakes you up at night, can't walk well. Groin pain is the number one symptom with the hip. So you're getting a lot of groin pain, it's just not getting better. I think, you know, those can persist. And the average time for a labrum tear to make it to a hip specialist, sometimes on average it's more than 6 months. So usually not an emergency, but just something that brews over time and the patient's not happy. The fifth question that I get asked a lot is, do I need an MRI? MRIs are very sensitive, very good tests to tell us what's going on. Do you have arthritis? Is there a labrum tear in your hip? They don't stand alone as the number one thing a hip specialist uses. You got to put the whole picture together along with the MRI. And we certainly don't get on MRIs on minor tweaks and sprains usually. But an MRI is a very good test and a very important piece of the information when we're trying to figure out what's going on. So with that, we're going to head over and do more hands-on with Bart and try to learn some of the rehab and tips for you to treat your hip pain.
Hey, I'm Bart from physiotherapy. This is John Blodgett. He's an endurance athlete here in Honolulu. When we see patients with hip problems from Dr. Crawford, a lot of the time we see them that they're tight in the front. So they have tight hip flexors and they have a lot of pain. So these few exercises that we give them first are really to just get the muscles firing in the back that help open up your hips. Okay, so the first one we do is just a bridge. So he's just going to start working through here. What we tell them is keep your core real tight, so you're kind of pulling your stomach toward your spine, squeeze your glute muscles, and push your hips toward the ceiling. Okay, a progression off of that is just to stay in that up position, and now he's just going to alternate his feet. Okay, by doing this, you put all the stability on one leg, so it forces one side to work a little bit harder. We usually tell people to do 3 sets, 10 reps. The next exercise is just going to be what we call scorpions. Okay, so he's going to stay in a pretty basic position. He's going to squeeze at his core here, and he's just going to move through his hip. So he's just going to extend through his hip, again, using his glute muscle, opening up the front of the hip. We tell people to do anywhere between 20 to 40 of these, and then switch sides. The next exercise is just plank. There are a lot of different ways to do planks. We tell people to focus on 4 things. The first is up top. So we tell them push your chest down so that your shoulders come back. Squeezing then at the core, squeezing at the glute muscles, and squeezing quads makes for a pretty stable position. People can hold this anywhere from 10 seconds to a minute. It's good if you shake, it means that you're starting to use a lot of your muscles. If it is easy, the progression off of that is just to do extensions through this. So again, you're trying to stay as tight here as possible and just move through your hips. You can do sets of 10 of this too. Try these exercises and see how it works.
So you heard some background about the injuries and things that we see, and then you got some good rehab tips, and hopefully that can help you stay out of injuries way and you're back on the mend soon.